My name is Dr. Glenn Wortmann, and I'm the Section Director for Infectious Diseases at the MedStar Washington Hospital Center. The Centers for Disease Control, the CDC, has designated November 13th through 19th as U.S. Antibiotic Awareness Week in order to help raise awareness of the threat of antibiotic resistance. What is antibiotic resistance and how does it occur? Well, bacteria are living organisms and are constantly evolving to survive and grow. Antibiotics are chemicals which have been developed to kill bacteria and usually act by interfering with the production of important proteins or by disrupting the cell wall which covers the bacteria. Bacterial populations consist of millions and millions of individual bacteria, and within each population are oddballs which have a mutation in their DNA which makes them resistant to an antibiotic. When exposed to this antibiotic, the majority of the bacterial population is killed, but the oddball bacteria survive and then multiply. These bacteria can pass their DNA to other bacteria, and thus resistance spreads across the population. If a patient becomes infected with these bacteria, the antibiotic won't work. It's hard to imagine, but antibiotics have only been around for about 70 years, and it wasn't that long ago that serious illness or death from infection was a common event. What can we do to slow down antibiotic resistance? By using less antibiotics, we'll select for fewer resistant bacteria. As healthcare providers, we need to use antibiotics only when needed. As a patient, you need to be aware of antibiotic resistance and work with your providers to avoid taking antibiotics if they're not needed. If it's wintertime and you have a runny nose and a cough, you most likely have a cold and don't need antibiotics. If it's springtime and you have a runny nose and an itchy eyes, you most likely are reacting to pollen and don't need antibiotics. Every time an antibiotic is given, there is a risk of allowing that oddball bacteria to multiply. So the next time you're faced with an antibiotic decision, stop and think, is it really needed? By using antibiotics carefully, we can stay one step ahead of the bacteria and save this precious resource for when they're truly needed.